You know, there are moments in our history when the ground shifts beneath our feet so quietly that most folks don't realize the world has changed until much later. And then there are moments like the early years of this century, especially around those long months in 2020 when the shift is loud, jarring, impossible to ignore. When we're suddenly forced to reckon with truths we've been avoiding for far too long. One of those truths is that our mental health, our sense of stability, connection, hope has always been as essential as anything else we fight for. But it took a global crisis and a kind of collective loneliness we didn't see coming to make us face how inaccessible help still was for so many of our fellow Americans. And now, as virtual mental health care begins reshaping the landscape of access, we're left with a question that cuts deeper than policy or technology. Are we finally ready to build a system that sees every person, hears every struggle, and treats every mind with dignity? Most people don't think about the long arc that led us here, but access to mental health care in the United States has never been evenly distributed. For decades, families in rural towns had to drive hours just to find a therapist. Working parents had to choose between a paycheck and an appointment. And too many young people learned early on to keep their pain quiet because stigma told them silence was strength. Then, when the world shut down in 2020, all those cracks in the foundation widened at once. Communities were isolated, anxiety surged, grief became a daily companion for millions. But something else happened too, something worth remembering. People started asking for help, sometimes for the very first time. Clinicians, strapped for resources, turned to telehealth out of necessity. Policymakers, some of them skeptics, just weeks before expanded insurance coverage overnight. And suddenly, that old waiting room with the flickering lights and long lines was replaced by a simple screen between two human beings trying to make sense of the moment. It wasn't perfect, it wasn't polished, but it was a lifeline. It was care. And it changed expectations in a way no legislation alone ever could. When I think about this shift, I'm reminded of my early days organizing on the south side of Chicago. I'd sit with families who were navigating everything from job loss to violence on their block to the daily stress of just trying to hold things together. And back then, we didn't have a word like virtual care or the tools to deliver it, but we understood the core of it being present, listening, offering real support even when resources were thin. Years later, in the White House, when we worked to expand mental health parity, we were fighting the same fight, making sure mental health was treated with the same seriousness as physical health. Still, progress was slow. There were late night calls with advisors, long meetings where we try to explain that a person's mind is not a secondary concern. There were moments of frustration when politics overshadowed basic compassion. And yet, over time, you learn something about change. It rarely arrives all at once. It comes through pressure, persistence, and sometimes through crises that force us to move. So when I look at virtual mental health care today, I see not just innovation, but the continuation of a long, unfinished effort to say to every American, your well being matters, your story matters, you matter. But reflections like these also come with a measure of caution because technology is powerful, and like any tool, it can widen divides just as easily as it can bridge them. Virtual care only works if people have reliable internet, digital literacy, and a quiet moment to themselves. Luxuries not everyone can claim. And privacy, that sacred trust between patient and provider, takes on new meaning when conversations move across networks and servers. Leadership in this era means refusing to overlook those risks. It means insisting that innovation bends toward justice, not convenience. It means recognizing that the health of our democracy is tied not only to how we vote or what laws we pass, but to whether people feel supported enough mentally, emotionally, to participate in our shared life. If we fail to protect vulnerable communities as telehealth expands, then we're not advancing progress, we're just redesigning its barriers. Still, I believe there's something profoundly hopeful in this moment because beneath the screens and software and policy debates, what virtual mental health care reveals is a simple truth. People are reaching for one another in new ways. A veteran in a small town can speak to a therapist without driving 3 hours. A single parent working 2 jobs can find support after midnight when the house is finally quiet. A young person wrestling with anxiety can talk to someone without fear of being seen walking into a clinic. These aren't small things. They're acts of quiet dignity. They're reminders that compassion is scalable if we choose to scale it. And they teach us something important about resilience, that in times of crisis, we're capable of adaptation, not just technologically, but morally. We can decide that no mind is too distant, no voice too faint, no struggle too private to deserve care. So as we move forward, we have to ask ourselves what kind of society we want to build in this new era. One where access is determined by zip code, income, and bandwidth, or one where every person, no matter their circumstances, can find help when they need it. We have to decide whether virtual care becomes a temporary fix or a lasting pillar of our commitment to one another. And we have to remember that mental health isn't a partisan issue, it's a human one. The question is whether we're willing to treat it that way. And maybe that's the quiet test of leadership in our time, not how quickly we adopt new technology, but how faithfully we pair innovation with empathy, progress with fairness, and convenience with justice. Because at the end of the day, the strength of our democracy will be measured not only by the laws we pass or the institutions we build, but by the care we extend to one another, especially in moments of uncertainty. So as virtual mental health care reshapes what's possible, we're left with a few questions worth sitting with. Will we use this moment to close the gaps that have burdened families for generations? Will we ensure that every mind, every story has a place in our vision of progress? And are we willing to choose a future where no one is left to struggle alone?